Selamat malam teman-teman semua. Jumpa lagi pada malam hari ini. Kita akan belajar tentang detoksifikasi. Bagaimana mengatasi peradangan untuk mencegah proses penuaan. Hari ini kita kedatangan dua narasumber hebat dari Malaysia, yaitu Dr. Ireyne dan juga Dr. Jevan, yang akan menjelaskan lebih jauh lagi tentang proses detoksifikasi. Saya ini agak-agak rewel kalau soal rasa ya. Jadi apalagi kalau yang udah harus berkaitan, makanya saya prefer kapsul karena langsung neren nggak ngerasain gitu ya. Tapi when comes in the liquid or in the powder, saya biasanya rewel banget soal rasa. Tapi ternyata begitu nyobain yang Royal Detox-nya Irene, wah ini kok enak ya. So, I think kalau sudah pass in my mouth, I think it will pass in your mouth also. Oke, so sebelum kita mulai, saya akan memberikan kesempatan pada Dokter Genti untuk memperkenalkan Dokter Jiwon dan juga Irene. Oh, by the way, Dokter Jiwon juga salah satu famous doctor di Malaysia for hormone stitching and also for peptides ya. Jadi kita rencana nanti di tahun 2026 kita akan membawa Dokter Jiwon juga. You have to come to Jakarta and we will gather the seminar for you. You to teach us. You have to transfer your knowledge, hormones and peptide to us in Indonesia.
Certainly. Looking
Okay.
forward to that.
Without further ado, Dr. Genti, the place is
Thank
yours.
you. Thank you so much. Halo, selamat malam teman-teman semua. Kita akan langsung perkenalkan pembicara kita malam hari ini ya. Dr. Jevan and Dr. Ireyne are both based in Kuala Lumpur. They have an impressive track record and experience in integrative, functional, and holistic medicine. While Dr. Jevan is a functional medicine and longevity specialist, Dr. Ireyne also a naturopath, physician, and holistic wellness expert. Combined together, both of them will share their wealth of experience with us this evening, and we are so blessed to have them on the same stage tonight. Malam ini kita akan bahas tentang why detox is essential, understanding body detox pathways, and juga kita akan bahas bagaimana clinical implementation, how to integrate detox into our practices. Mungkin itu yang menjadi topik kita. So without further ado, let us welcome Dr. Jevan and also Ireyne for this presentation. Please. Thank you.
Thank you everyone. Selamat malam. Harap teman-teman semua baik di sana di Indonesia. Saya perkenalkan diri saya dulu. Saya Dr. Jevan. Di kiri saya Dr. Ireyne. Dr. Ireyne ialah Naturopathic physician. So praktis kita di Kuala Lumpur. Ya. Namanya Wise Gene Atelier. Dengan Dr. Ireyne dan saya. Tugas Dr. Ireyne ialah memberi nasihat tentang natural food dan juga cara-cara detox. So semua pesakit yang datang kepada kita untuk apa-apa gejala yang mereka hadapi, first step is always detox. Selagi mereka tidak setuju untuk buat detox, kita tidak akan menerima mereka sebagai pasien dan kita tidak akan mulakan rawatan-rawatan yang lain. Sebab yang pentingnya, we must learn or we must relearn to treat the patient as a whole, keseluruhannya. We cannot treat just based on results or the blood test results or any treatment results that you have, because we have that is cara you are treating the numbers. You are not treating the person as a whole. So kebanyakan rawatan walaupun amat canggih selalunya tidak berkesan because immediately they are trying to do the second step, which is replace suplemen ke dengan secara IV drip ke intramuscular ke. Semuanya tentang menambahkan suplemen atau menambahkan micronutrition. Tapi yang kita perlu sedar, sel kita mikroskopik dan sel ada ruangnya yang terhad. Sebelum sel boleh menerima masuk nutrisi, sel itu perlu keluarkan toksin atau waste bahan-bahan yang tidak perlu, waste material, sebelum dia boleh berfungsi secara optimal. So our practice menggunakan functional medicine 5R protocol. Protokol 5R. Nanti saya akan terangkan selanjutnya ya. So a bit of myself. I have more than 20 years experience pengalaman dalam bidang kesihatan holistik dan longevity atau umur panjang. Dan juga diiktiraf dalam pengobatan fungsional oleh Institute of Functional Medicine, United States of America. And I am one of the first doctors in Malaysia to be fully certified by IFM. You can, semua doktor boleh Google ifm.org and find a practitioner di Malaysia. You will see that we are certified by IFM. And I am now also becoming an anthroposophy doctor. So we also incorporate using a lot of natural remedies to help the body detox and repair. Juga diiktiraf dalam terapi pemulihan hormon secara bioidentical. And I think now is a very exciting time untuk praktikkan hormon bioidentical sebab baru minggu lalu US FDA telah has removed the black box warning on bioidentical hormone. Selepas lebih 30 tahun of perjuangan, they have finally realized that bioidentical hormone tidak menyebabkan cancer. So it's very exciting times because finally you have the encouragement, you have the acknowledgement that bioidentical hormones are safe. US FDA has finally removed the black box warning on bioidentical. Bukan hormon sintetik, tetapi bioidentical hormone. Juga saya telah diiktiraf dalam memberi training untuk terapi peptide dan juga exosom. Sebab ini semua adalah signaling molecule untuk badan repair secara holistik. Bukan hanya bergantung pada ubat-ubatan sahaja. Right? So itu adalah teknologi yang baru untuk regenerasi dan penyembuhan sel. Kita juga buat amalan 5R detoxifikasi yang saya akan terangkan selanjutnya. Saya juga memang mengandungi pengalaman dalam analisis epigenetik dan juga menangani penyakit kronik. Sebab kita mengamalkan rawatan-rawatan yang begini, kita boleh reverse atau keluarkan kebanyakan ubat yang pasien mengambil. Sebab functional medicine is root cause medicine. We treat the root cause, the body can repair. You can reverse their medications. You can reduce their medications. All our patients, within 1 month, we take off their statins, their cholesterol-lowering medications, and their cholesterols are much better because detox is also very important. Yeah. So, bagaimana perlu memahami tentang detox? So, semua manusia daripada kiri kita bermula dari satu single cell yang bergabung jadi tisu, yang bergabung jadi organ dan manusia keseluruhannya. Ya. So dari sini tetap beginilah proses badan menjadi maturation. Dan tetapi masalahnya ujian saringan kesihatan semasa hanya berfokus pada tahap organ. So bila buat ujian darah, kita hanya dapat maklumat apa yang berlaku pada tahap organ. So kalau ada masalah, ada tes-tes yang menunjukkan ada masalah dalam ginjal atau dalam hati, liver atau buah pinggang, kita hanya merawat organ. Tetapi masalahnya, so beginilah kita buat ujian saringan sekarang seperti ujian darah, X-ray yang hanya bertumpu pada penyakit. Ini adalah perawatan reaktif. Kita buat apa yang sedia ada di depan kita, itu yang kita mula merawat dengan memberi ubat. Tetapi kerosakan berlaku di tahap sel. Ini yang kebanyakan doktor kita sudah lupa cara nak merawati kerosakan yang berlaku. So itu yang kita perlu betulkan, kerosakan yang berlaku di tahap sel. So apa rawatan yang sepatutnya kita buat? Kita mesti meningkatkan kesedaran gaya hidup sehat. So, mesti memberi awareness tentang healthy lifestyle and detox. Most of our patients will not agree to do number one. They say, ya, tak maulah, no time to exercise, no time for detox, I just want the medicine. That is the wrong mindset. That is the old way of treating health conditions. We are in the 21st century. We should use 21st century medicines available to correct our health. That is when we are going to increase the health span of a person, not only the lifespan, right? We must have good community education tentang pilihan makanan yang sehat. Makanan-makanan proses, makanan instan, semuanya akan mendorong radang. Keradangan yang menyebabkan penuaan dan juga menyebabkan penyakit. So the new term is not only inflammation. Inflammation is the root cause of aging. It is inflammaging. So when you correct inflammation, you are able to slow down and reverse aging. That is our main aim. And we don't only use standard blood tests, we also go into metabolomic testing. Apa makna metabolomic? We are looking at the blood metabolites that can give you a signal where you are headed with your healthcare. And we can reverse a lot of diseases before it happens. And we also must do ujian saringan CTC atau circulating tumor cells sebab selepas gejala COVID dan vaksin, sekarang adalah masa yang amat merunsingkan dengan turbo cancer. So this should be our proactive method of healthcare. So what is the main reason or main causes of cell damage? Radang. Okay, makanan olahan, sedentary lifestyle, smoking, more than smoking, vaping, that is killing millions of cells every second. Chronic stress, toxin, all our detergents, unfortunately for ladies, the cosmetic, minuman dalam botol yang banyak mengandungi microplastic, chemicals. These are all day-to-day toxins that we are loading into ourselves. Secara sedar atau secara tidak sedar, toksin dan keradangan is meningkat dalam semua sel badan kita. And then of course you have all the environmental pollution, electronic device, EMFs, all that is also worsening the inflammation. And we are so micronutrient deficient. Nobody is taking proteins any longer. It is all carbo, it is all processed food. That is the reason we are getting depleted. We don't have protein. Kita tidak ada cukup zat garam mineral, dan tanpa zat garam mineral, vitamin, protein dan kolesterol yang baik, sistem hormon kita has shut down. And that is one of the reasons also why it makes aging become much, much faster. And we also have a lot of chronic infections now sebab immune system kita telah tertindas selepas diberi vaksin. So, viruses seperti Epstein-Barr virus, cytomegalovirus meningkat. Parasites, fungus, bakteria dalam semua sistem kita meningkat sebab immune system tak dapat menangani atau melawannya sudah. Yeah. So this is what's happening. We think our health is like the nice apple on the left side, but actually we are rusting inside. Berkarat, oksidasi, oxidative stress. Inilah akibatnya, ya. And let me tell you, these are all the toxic metals that is there in everyday food. So these are also the reason the cells becoming much, much sicker. Your mitochondria are not functioning well. And that is the reason why many people are having so many health conditions. But yang anehnya, you cannot pick it up from blood tests. We are seeing so many patients who have gone around seeing 10 to 30 different doctors. They have done 10 to 30 different blood tests, and the doctor has told them, your blood test is normal. But they still feel unwell. They have joint pains, they have insomnia, they have digestive issues, they have bloating, they have skin disorder from allergies to eczema to psoriasis, but their blood test is normal, or they have chronic pain. And because the blood test is normal, the hospital or conventional doctors unfortunately cannot offer them any treatment. And the worst is, or the only quick fix is steroid. So that is further akan menyebabkan chronic fatigue syndrome as we know because of adrenal insufficiency. So when we have all this, you need to equip yourself with new tools. We need to give new tools to our patients to help them get better. So up to now, is everyone okay with the presentation? If yes, just type 1 in the chat group, please.
Are you
Is
able
everyone
to follow?
okay? Is it following all right?
I think perfect. Yeah.
Okay, thank you. Everyone, okay, thank you. All one. Nice, thank you very much. I'm glad to hear that everybody is following. So this is how we explain to our patient what is going on in their body. You see, they come in with all the diseases, diabetes lah, obesity lah, joint pain lah, cancer lah, and we are just treating the surface. This is called the iceberg phenomenon. Sebab masalah yang di bawah paras air ialah inflammatory imbalances, hormonal imbalances. The body's natural detox pathways are all blocked. You have digestive, absorptive, microbiological, maknanya banyak patogen dalam badan. Dan juga banyak masalah emosi. You have a lot of personal trauma. That is the reason why now I am going to pursue anthroposophy medicine, which helps a person, because we have seen patients from the time before COVID, we are able to help them address a lot of their physical or chronic metabolic health issues. But after vaccine, the same patients come back to us with many problems, which we had already optimized them with hormones, with proper nutrition, but now it is the emotional trauma that is being triggered. So all that is why we need to do detox, yeah? So right now, this is the only answer patients have. They are put on pills and pills and pills and more pills. Patients are sick of it. They just don't want to take any more medications. So bagaimana kita menanganinya? This is our protocol. This is what I said, the 5R. Why we focus on the gut? Sebab even from Hippocrates' time, he has said, all diseases begins in the gut. So kita gunakan pengamalan 5R detox ini untuk improvekan kesihatan seorang individu. So the first R is remove. So until and unless you remove, your cells cannot detox out the toxin, and they cannot get replacement, which is your micronutrients. So micronutrients is including everything, daripada protein as amino acid, your cholesterol as fatty acids, good cholesterol as fatty acids, or your omegas. You are not getting all your vitamins, whether it is water soluble or fat soluble vitamins. You are not getting enough of minerals or zat garam galian, especially magnesium. And you are not able to get enough of good nutrients going in all the way down into the cell. So before you even replace, you should do detox to clear out the leaky gut, keradangan dalam usus. Then only you're able to replace. When you replace your micronutrient deficiency, baru kita boleh restore function kepada semua organ-organ dan tisu-tisu. Bila restore fungsi, baru sel dengan tisu dan organ boleh betul perbaiki, which is the process of repair. Only then you can rebalance your whole body health to prevent further reoccurrence of the same problem. So we will share you the slides. You can take photo of the slides. Get your patients to do this 5R. You must start with removal. And how do you do removal? Or why it's so important is, this is how I explain about drainage before detox. So this is our natural, the inverted pyramid is the natural detoxification system in our body. So the cells make up the highest number in the body, so that is why it forms the top of the inverted pyramid. Cells will detox into the organ and tissue, and organs and tissue will detox into the lymphatic system. Hanya lymphatic system yang akan mengeluarkan all the toxins from the body. It cannot go back through the blood. If it is being redistributed into the blood, that is why we have all the problems of skin disorders or kidney damage or lung problems, because the lymphatic cannot drain into the liver and the bile duct. And from the liver and bile ducts, it masuk ke dalam usus atau colon. So when we do the inverted pyramid like this, you need to open your detox channel dari bawah. So you need to open the detox daripada colon, daripada usus besar. That is why we use RD or Royal Detox untuk membuka saluran detox di dalam usus besar, supaya hati dan gallbladder boleh mengeluarkan toksin dan detox ke dalam kolon. Bila dua sistem bawah ini dah terbuka, baru lymphatic system boleh detox atau membuangkan toksin-toksin ke dalam liver and colon. So that is how it works backwards. You open your colon, you open your liver and bile duct, you open your lymphatic system, then only your organs and tissues will start to detox. Then only the cell will start. So this is the reverse cascade that I always use, which we call opening your drainage system before your cells can detox, or drainage before detox. This is how I like to call it. Yeah. So how do you detox? It's not only about RD. RD is one of the methods. So detoxifikasi adalah cara semula jadi. We want to be holistic. We want something that is sustainable. Most of the detox products now fail sebab selepas detox, people think detox means boleh mengurangkan berat badan. But most of the detox product out there menggunakan they use a lot of laxative. So laxative itu is artificial, it is synthetic. It will cause you to lose a lot of fluid, you will get dehydrated. So that is why their weight comes down. But selepas you stop there, your body will ask for more water and they gain back the weight. RD doesn't work that way. We are doing natural way to really clean up the colon. That's what RD does, yeah? So what are the other ways that you can do to detox yourself along with the RD? I'm going to share a few natural detox protocols here. The first one that is really effective is puasa or intermittent fasting. Get your patients to also do intermittent fasting because when we fast, especially if they can do intermittent fasting for 3 days or 72 hours non-stop, your body goes into autophagy mode. I'm sure all the doctors here have heard about autophagy. So bila sel dalam situasi autophagy, dia akan mengeluarkan banyak toksin juga daripada sel-sel yang ada. So fasting, intermittent fasting is a very good way of doing a natural way of doing detox. Grounding, this is very important as well. That is when you are going to discharge all the too much of the energy that you are holding down back into the ground. The positive ion masuk balik ke dalam permukaan bumi. Have you had patients? We have patients who come and tell us they can go and touch the door atau they touch another person, they get static electricity. That tells us they are overloaded with the ions. They need to do grounding to form the detox. So, and all this EMF kan, electromagnetic frequencies, mereka juga akan mengubah the ionic position of the cells, and that can cause mitochondrial and DNA damage also. So grounding is another good way of detoxing the cells. Sunlight, it is so important. All of us, especially us doctors, what is our sunlight? The light like this, the LED light that you see, this is our sunlight. From 8 o'clock in the morning up to 8 o'clock at night or 10 o'clock at night, this is our sunlight. And without sunlight, we are all depleted in vitamin D. It is so essential. Vitamin D is something that your body needs for hundreds and thousands of metabolic activities, immunological processes. Vitamin D is essential. We give vitamin D to our patients, injectables, oral. Every patient gets vitamin D. And when you want to supplement with vitamin D, don't only look at their vitamin D levels. Now, there are a lot of confusion. I'm going to divert a little bit. I'm going to go into vitamin D. I know it's not part of our topic today, but I have to share this because most of us are still very hesitant, or we are terperangkap, we are what you call disturbed by the levels, the ranges.
Yes.
We have to understand when you do a blood test and you get the ranges on the side, that ranges, do you know how the lab comes up with that levels? Any idea? Anyone? Okay, let me share. So a lab will have to, as you send blood tests to the labs, they will see what is the average of all the levels that they are of the ranges, and that's how they get the ranges. So the natural values or the ranges that you get for your blood test is the range that they have, the data that they get from the sick, that means yang tidak sehat, and elderly population of that region. That means if you take a blood test from the populasi di Jakarta, you take the blood test of the populasi dari, let's say, Medan, and you compare with those in Bandung or Surabaya, your ranges will be different. So never look at the ranges, always look to the optimal levels. So optimal levels is always the higher end of normal. And when you want to look at vitamin D, jangan hanya tumpukan pada result vitamin D. Look at their parathyroid levels, intake parathyroid hormone level, dan juga corrected calcium levels dari renal profile. Jika even, and you must use the unit that is used is nanogram per deciliter. Jangan gunakan yang nanomol, NMOL. Kalau nanomol, range must be lebih daripada 250. Kalau nanogram, mesti 100 dan ke atas. Tetapi, also dasarkan or look at the intake parathyroid hormone. Intake parathyroid hormone level should be below 1 because nowadays with all the spike protein injuries, it is also causing a silent pandemic called vitamin D resistance. So that means your blood levels are showing 100 nanogram and above or 250 nanomole and above, yet your parathyroid says, I need more vitamin D. So if your parathyroid levels are more than 1, it means you are still vitamin D deficient. You can safely increase your vitamin D levels. So do you know that Dr. Irene and I, we keep our vitamin D levels more than 500 nanogram per deciliter. Why? It is only when we reach those levels, our parathyroid hormones are now below 1. So don't get frightened by the labs or the conventional studies out there. You need to educate your fellow doctors in conventional medicine that there is no toxic levels of vitamin D just based on vitamin D levels alone. Always combine it and look at it in combination with intact parathyroid hormone dan corrected calcium levels. Okay? All right. So that's a small, brief divergence from detox. Cara keempat is when we do workout. All our patients will definitely do workout, so that you must do that to help your body detox. Bila kita berpeluk, bila kena cahaya matahari, and you are also doing a little bit a form of grounding, you are detoxing 3 in 1. Yeah. Sleep is very important. You must have at least 6 to 8 hours uninterrupted sleep every night. It cannot be I sleep from 10 to 2 and then I continue sleep from 5 to 8, and so I have got enough the 8 hours, tidak mencukupi. It must be uninterrupted sleep. Meditation, this is the new age detox ya. So untuk detox minda dan juga jiwa kita. So meditate, listen to music, just help you to reduce your overloaded cortisol levels. Friendship, very important. Get the ladies, you can get your friends, go for spa, you can have a day out. Guys, you can go have a game together, watch a football game together, you detox. All right? And these are the tanda-tanda yang Anda memang memerlukan detox. Okay? All our patients come in, they will have all the symptoms. One also is enough to say you really need detox. Mereka always complain. Penat, lesu. I'm just tired. Saya dah tidur 10 jam tiap-tiap hari. Tetapi bangun pagi, masih blur, masih mind fog. Or the other end, insomnia, they just cannot fall asleep. The brain fog, they cannot focus, always feeling down, very depressed. Penghadaman tidak baik, no need to say lah. You're either constipated or you have a lot of bloating. Eat a little bit also, you feel like you're having reflux. Or they say, when I poop, I can still see like the down sayur or undigested particles still coming out through their stools. Muscle aches, joint pain, and the one that I really would like to impress on everybody is when they have nafas berbau, when they have halitosis or bad breath, please look into their mouth. Just take a torchlight and shine into their mouth. Look for any amalgam. Amalgam in Malaysia is a big issue, and I'm sure it's also in Indonesia, is when you have that silver color filling in the teeth that is full of mercury. You need to work with your dentist colleagues over there, dental colleagues, and you should help them to find out who can do like what we call biologic dentist. Sorry?
Oh, it's okay.
Okay. All right.
I
So work with the biologic dentist. Try to get them to put all the silicone covers, which is called rubber dams, for before they do drilling and removal of the amalgams and replace it with composite material. Any of our doctors or any of our patients have done a root canal treatment more than 3 years, get your dental colleagues to do an X-ray of the whole mouth called OPG, Orlando, Penang, Ghana scan, OPG scan, that will tell if they have any infection in their root canal. Most of our patients have a lot of autoimmune disorders because of either amalgam or an infected root canal. And it will affect the same side of the body. Kalau ada amalgam di sebelah gigi sebelah kiri atau root canal infection di sebelah kiri, they can come in with migraine. We have seen patients with the same side, women unfortunately with same side breast cancer because they still have the amalgams or they have an infected root canal. Men, they can have infected root canal. That is the root cause of their heart attack. That is why they now have got 2 stents in the heart. So look at all that. So these are the root causes. We need to eliminate these root causes before it causes unreversible damage in the body. Yeah. And why we need to detox? Sebab the air we breathe, the water we drink, the food we eat, all contain toxin, all contain chemicals. Yeah, the air pollution, I think in Jakarta is, I don't need to say, you all know it better than us here. Here, even in KL, it is getting worse. Certain days, the pollution is really bad. And then we are given so much of antibiotic usage that has really destroyed your entire gut microbiome. And all the toxins are also doing its damage in the whole body. So we need to detox, if possible, on a daily basis. Yeah. So that is why we use RD Pro Series or Royal Detox. Why our patients like this and why we see the improvement is because if you can see on the bottle here, the logo is this yellow flower. This yellow flower is called almatas. Okay, almatas is the key ingredient dalam detox juice ini yang benar-benar membersih dan memulihkan tubuh. So why it works so well is because it helps to clean out, if you see this image on the right, it helps to clean out all the blockages, the mechanical blockages. Our stools are now is the very sticky type yang melekit. So that is the one that is sticking to our entire digestive tract, starting from the duodenum, where digestion and absorption should happen. You are already getting toxins which are sticking there, the lipopolysaccharides, all the bad bacteria. That is what is sticking, preventing absorption, and they are stealing all the nutrition that is supposed to be absorbed at the intestinal level, especially in the duodenum. And because of that, the body also tries to increase acid to try and kill those bad bacteria. Tetapi, as you know, acid cannot enter into the intestine. It can only stay in the stomach. So when they have too much of acid, they feel the burning, they go see the conventional doctor, and they are given proton pump inhibitors untuk mengurangkan acid. So that again prevents the digestion, the destruction of all the bacteria or the toxins that comes in with the food. So first thing that RD helps to do is it helps to improve the digestion process and cleans out the toxins from the intestines. It improves the immune system because there are many antioxidants and ascorbic acid or vitamin C in the Royal Detox or RD, right? It is very good to overcome infections. So why they use this RD or why they use Almatas, since even before Ayurveda, it's called Unani medicines, they have been using Almatas as antipyretic or untuk melawan demam, also anti-parasitic and anti-malarial. So when you have all this out from your system, when you have removed the parasites from your system, it helps the immune system function better. Very good for wound healing. Kalau ada sesiapa yang have any wounds, diabetic wounds, you have also like hemorrhoids, piles, kan? What do you call that?
Anal fistula.
Anal fistula atau hemorrhoids. It is also a form of wound which the body is trying to show. Boisir, yes, boisir. Thank you, Dr. Ireyne. So boisir and all that is also works very well to get rid of all the hemorrhoids of boisir and also anal fistula. Many patients have recovered this on RD despite having undergone many surgeries for anal fistula. And it's very good to protect the hepatobiliary system. So in all those, like, all the medications, the antibiotics, all go through the liver as first pass metabolism, but it is leaving back all the toxins in the liver. RD helps to cleanse the liver juga. Okay, it really improves the bile excretion so that you see that the digestion, pencernaan also improves better. So these are the three main ingredients in RD. So you can see is this yellow flower on the tree at the top. This is where the flower and the pod, so the entire plant is used to make Royal Detox. And this Almatas flower is the national flower. If you Google it and see, is the national flower of Thailand and also the national flower of the state of Kerala, where is the birth country of Ayurveda. So they use this for centuries. It is natural, it is effective, it does not have any toxins in it, it has no preservatives in it. And later we will send the studies, the research papers where it proves that Almatas is beneficial for a variety of pathogenic conditions. So RD contains Almatas, and at the bottom here you can see ini adalah bunga roselle. So they take the active ingredients from roselle. So Almatas and roselle, if you follow the Chinese traditional medicine practice, These are all the cooling type of foods or the yang natural foods. So that is why we add in the ginger or halia to be the warming. So what we want is a balance, right? The yang and the yin, so that it helps the whole body to detox very well. So how do you take it? We will give this later more in detail, don't worry. Okay, bolehkah saya mengambil RD Pro Series bersama ubat atau suplemen lain? Certainly boleh. Tapi jarakkan pengambilannya. Ambil RD dahulu. First thing in the morning, sudah bangun, dah gosok gigi, minum RD. Dan sejam selepasnya, baru minum ubat atau suplemen yang lain. Ya. So how to take the RD? We will show you how the bottle. So the bottle, when you see it, will have a lot of sediments right at the bottom. So you really need to give it a good shake so that the sediments mixes well into the liquid. And then if you are starting, you take half bottle a day. If not, you consume the full bottle. Dan kalau ada bakinya, like if you're taking half bottle, baki half bottle itu tidak perlu di refrigerate. You don't have to simpan dalam peti sejuk. Boleh diletak dalam dapur atau living room dengan tidak kena cahaya matahari yang panas. And it can stay if safe in the normal room temperature for 2 to 3 days duration. So like this is the RD bottle. You will see the sediments here. You cannot see, right? So now you give it a nice, good shake. Then you will see, now you can see that the sediments have all cleared and it is mixed. Dah sebati dengan jusnya. So baru koyakkan the label and then consume. You can. One bottle is 180 ml. So kalau setengah botol is 90 ml. Right? So selepas minum setengah botol, you can tutup the cap and just keep it at room temperature. For it won't go bad, it won't turn bad because you have to understand all this is natural, no preservatives. So that is why many people are worried that it can get spoiled. So maximum 2 to 3 days, no problem. Yeah. Okay. How long do I need to detox? Yeah. You can take one cycle. One cycle means for 1 month. Selepas itu, then you can do the detox every 3 to 4 months. 1 more month you can do the detox. Yeah. So this is how you tell your patients how long they can do detox. For me, I will tell my patients, you need to detox lifelong. Why? They say, huh? Lifelong I need to detox? I say, yes. So what I mean is, bukan minum satu botol tiap-tiap hari for the rest of your life. Every time we eat, we are putting toxin into our body. Kita makan at least sekurang-kurangnya 3 kali sehari. So 1 week, you're eating 21 times. If you, for a month, you are now going to eat 84 times at the very minimum. 84 times you are putting toxin into your body and you don't want to do detox and take out the toxins. That's why people don't get well. They always come back with illnesses, right? So that is how I will always tell our patients, you do detox for 1 month. After that, 2 to 3 bottles every week as maintenance. So you take half bottle, 2 times a week is 1 bottle. Enough. That's quite good already. Yeah. So these are the ingredients again. So now I will tell how we advise our patients to take RD for different conditions. Okay. So again, ingredients is the almatas flower. And not only the flower, they also use the leaf, the stem, the root, and the unripe fruit. So the whole fruit, the whole plant is used to make RD. along with roselle and ginger. Yeah. So now most of us have poor gut health. Maknanya banyak radang dalam usus and most have leaky gut. So this is how you need to take RD, where you take it half bottle for the first 2 days. So this bottle, setengah botol hari ini, setengah botol esoknya. So when you are starting to take RD, tell your patients, all the doctors, you all should try it first, yeah? We try on ourselves, then you will know how to explain it to your patients. So when I started taking RD, I took half bottle today, half bottle tomorrow, no effect. Then I called Dr. Irene, I said, tak jalan lah. Then she said, okay, you take 1 full bottle. So when you start, you always start waktu pagi. Start taking first thing in the morning because when it starts working, the effect is you will go to toilet a few times a day. So that is why we don't ask them to start waktu malam. So start bangun pagi, sudah gosok gigi, half bottle today, half bottle second day. Selepas itu, for the next 2 weeks, you take 1 botol setiap hari. So I took for another 10 days. Sama saja. I only went to toilet 1 time a day. She says, you punya. I said, no, my usus very clean. I got no problem. I never had constipation or sembelit. Now I take RD also, everything is great. She says, no, cannot be. Something wrong somewhere. So for all the older generation doctors, you might have known laxative last time called milk of magnesia. I don't know if anybody masih ingat, but I was given that as a child by my mother. So milk of magnesia tu you dah minum is a real laxative. It's like, you know how they do colon cleansing before they do a colonoscopy? It is as powerful as that. So my bowels have become so sluggish that even RD didn't work when I took it for 2 weeks. But on the 15th day, I said, never mind lah. Today I'm taking 1 pagi, 1 botol pagi, 1 botol malam. 16th day, I started going to toilet. I went 10 times. It's not diarrhea, yeah. It is just loose stools. I feel like nak go buang air besar, go little bit, comes out, and then I'm back. I sit down, I'm seeing patient, I'll tell them, excuse me, I will run back to the toilet. But like that is 10 times. But you don't feel tired, you are not dehydrated because this does not contain laxative, which pulls out your minerals when you are passing motion. You won't have diarrhea, ya. Bukan macam keracunan makanan, food poisoning type of diarrhea. You just, you're bombing your toilet. Bukan begitu. It is just gentle cleansing. You are able to push out the stools every day. So from the hari ke-15 until another 10 days, I was going 10 times a day. So 2 weeks, 10 days after 2 weeks, I was going toilet 10 times per day. But you know what? My belly became flat. I felt more energetic every day as I'm waking up. And it is also very good for men untuk tenaga batin. This is really, really good because you're detoxing a lot of the toxin, which is in your usus besar. And that is where your batin is, right? That's where all our reproductive organs are. So for some of my patients, even the ladies, when they start taking Royal Detox, they start having discharges which they never had before. Then when I ask them, they say, yes, last time I used to have candida, yeast infection. Sometimes it comes and goes, but I never bothered. But sejak ambil RD, you can have a lot of vaginal discharge. So that's natural cleansing, not only from the usus, but you see it's working everywhere else as well. Yeah, so you'll have a short-term discharge, maybe for about 3, 4, 5 days. Don't have to go and do any, please don't put them on any antibiotics. Just let them do natural cleansing, works very well. Then the next 2 weeks is you do half bottle again for next 2 weeks. So first 2 days, half bottle, half bottle. Next 2 weeks, 1 bottle a day. And the following 2 weeks, half bottle a day. So that is how we know that you will, in one box, you will see you have 24 bottles of RD. So you need at least 24 bottles to do 1 month of detox. Selepas itu, boleh maintain dengan 1 atau 2 botol seminggu. So like, we have medical talks. It's the day, like some of it is in the evening, or you do on a Saturday, Sunday, makan di hotel, and the food there still contains a lot of toxins. Those are the days I will do. Like if I go for conference, Saturday 1 bottle, Sunday 1 bottle. By Monday, I'm nice, alert, energetic when I'm back at work seeing patients. So we also use RD with peptides for weight loss. Okay, I'm just going to give you all a teaser. I know you all are very advanced doctors. You all use all the GLP-1 peptides, but you know the side effects of all the GLP-1 peptides, macam semaglutide, retatrutide, tirzepatide. All of them have side effects, which is the nausea or the vomiting. And now you know the newer studies, newer research that is coming out daripada Ozempic. It is also a trigger for muscle loss. You're having bone loss or osteoporosis. And now there are people with having blindness because they are just doing semaglutide without supervision. So what we do is we step back and we go old school a little bit. For our practice, we use RD and we use AOD, anti-obesity drug. That peptide is very gentle. It really helps the body to release out the fat cells without rebounding when you stop the peptides. When you stop not only you stop the peptides or you don't do the RD, you won't see a rebound in the weight. So that is how we combine Royal Detox RD with weight loss peptides. We only prefer to use, yes, you are very good. You do your very good patient selection and you're using the weight loss peptides, the other GLP-1s. You combine it with RD, you won't see a rebound in their weight, but you have to manage their side effect, the symptom of the nausea. All right. Now, it's also very good for a natural, gentle parasitic removal. The Almatas has the property to remove. So you kena ingat, when you're talking about parasite atau fungal eradication, you must remember the life cycle. You have spores, ova, adult. So one round of detox when you do, you will remove the adult parasites. But the ova and spores masih ada. So if you're using any anti-parasites like albendazole, mebendazole, fenbendazole, or ivermectin, you combine it with RD. So you remove all the 3 at the same time. So you don't have to do too many cycles of anti-parasitic when you combine with RD. You want to enhance nutrient absorption. It's also good sebab it removes all the stuck toxins on the wall of the intestine. So you remove all that toxin, absorption now happens better. And we do it for maintenance also. Any adult below 65, 2 to 3 bottles seminggu. Senior citizens above 65, you just do half bottle a day, Monday to Friday. Cukup. And then they continue every week, Monday to Friday, for 9 to 10 weeks. That's good enough already, right? And it is even safe for children. Yes, here we put it as 8 to 18 years, but once you are already very good your advanced level of knowledge of this, we do that. We even give it for children from 2 years of age and above. Because you got to understand, it is safe, it's all natural. It is not going to affect the mother. It's not going to affect a pregnant mother. It is not going to have any serious effect in breastfeeding mothers as well. So for babies below 2, we will not recommend yet because you have not got enough of experience. So stick to 8 years and above. But we have, our data shows it is safe in those above 2 years of age. We just give them 1 teaspoon. The fever comes down very fast. The child recovers much better. Tidak perlukan paracetamol. Children need to have the fever because that's what wakes up the immune system to fight any pathogen. So we support the body by removing some of the pathogens through RD, right? So remember, you need to shake well before consuming. Tidak perlu refrigerate the juice. Once open, can keep in room temperature for 2 to 3 days. Cap it tightly ya. Jangan transfer ke dalam gelas lain and simpan dalam gelas sebab that this bottle when before the liquid is put in, it is pasteurized. After the RD juice is inside, they also seal with this label, and again it is pasteurized. So it's double pasteurized. It will not get infected with any bacteria or it doesn't turn bad just by keeping it in the bottle. Yeah. So people ask, how frequent should I detox? You do 1 cycle for 1 month, and then you can detox every 3 months one. So for maintenance, yeah. So what are the symptoms? What are the symptoms? I will always tell our patients, no symptoms, no good. Tell them, huh? I say, yeah, you must have symptoms. You got to change your patient's mindset. No symptom means they are doing something wrong. They need more detox or they need longer detox. So you see, for me, I needed 2 bottles a day before I started the cleaning out process. So some you need to go up to 2. From all our thousands of patients, only 2 patients needed double dose of RD and I am one of them. And before I started RD, I was 112 kilos. With RD, now I've been on Royal Detox for the last 2.5 years.
No AOD, no
that time
peptide.
I didn't use peptides yet. I didn't need to do because with RD alone, because I took it, I didn't do the normal way, like we say 1 month kind. I did for 2 months, 1 bottle every day. So it was like nearly 48 days, and in between was like 2 bottles a day. So I think I would have, for 2 months, I think I would have finished about 60 bottles of RD, because some days I'll take 2, some days I'll take 1. Now my weight is 87 kilos, and it has stayed the same. It has not rebounded back to 112 as it was. 2.5 years, my weight has maintained. I've had to shrink down my wardrobe by 2 sizes. Daripada double XL, now I'm using all the baju, the pants is all L. Some cutting, I need XL, but I've come down from double XL to L. So this is my personal journey I'm sharing with all of the doctors here. Yeah. So you will have a little bit of stomach discomfort. You'll feel like cramping, colicky pain, or the most embarrassing one is you sitting consulting your patient and then your usus may koyong, 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 koyong. The bowel movement, the Vogborimi movement. I had that. Some won't have, some will have, right? So that is why that we do the detox to help the bowels flush out the stools, the najis yang sudah keras, yang sudah melekat. You detox that out first. Then once your colon is clear, that's when your liver will start to cleanse and the gallbladder starts to cleanse. And that is how you remember the inverted pyramid. So your colon, then your liver and gallbladder, that's when your lymphatic system is now open. The jalan, the detox pathways are open. So you must explain to your patients, you must prepare them that they will have bowel toilet episodes. You will have bowel symptoms, but the effectiveness you can see after at least 2 weeks of doing the Royal Detox RD. Okay, if you have, and some of them you see once they start doing this, they will come back and say, Doc, now I feel a bit giddy lah, I feel a bit tired like that. That means they were starting itself at the beginning itself, they are already micronutrient depleted. So when patients, we always follow them up closely for the first 2 weeks. Our staff always WhatsApp our patients and ask, how are you today? Berapa kali sudah pergi ke tandas? Any symptoms? When they tell you they feel a bit giddy or they feel lightheaded, we will call them back, ask them to come back. We will check their blood pressure, we will check their sugar levels and see how they are doing. Most of them will see a drop in their random blood sugar. Their blood pressure begins to come down. And just by using RD, some of our patients, we have successfully removed 1 or 2 of their OHAs, as well as their antihypertensive medication. And then some will say, I feel very lethargic, I've got like muscle cramps. So that is when you tell them, yes, you are experiencing all this because you are micronutrient depleted. That is the time you put them on a Myers cocktail drip dengan you punya all the minerals, the magnesium, some vitamin C. I'm sure you all are well experienced how to do Myers cocktail. So that creates another revenue stream. That is how we also do for our patients. We tell them all this, you will experience all this. So they know when this is happening, okay, my micronutrients tidak mencukupi. So they will come back and see us. So that's how you follow them up. And this, you can take it during your intermittent fasting. Yeah, so that's very important because all inside this, there's no artificial sugar. It's all natural sugars. So you don't break your intermittent fasting if you're taking RD or if you're taking your black coffee, your green tea, it works the same principle. So RD, you can take it during intermittent fasting juga. Yeah? Okay. Yeah. So now we are not only talking lah. We are going to share with you all our patient's testimony yang sudah membuat detox for a few rounds, a few cycles. Yeah. So this is the first testimony, Mr. Wai Kiong, 32 years old businessman. Because of work, he is in the automotive industry, deals with a lot of petroleum products and all that. So his exposure to chemicals was very high. Insomnia, very easily hot-tempered, blood pressure is going up. 32 years old, he's already on 2 antihypertensive medications, a lot of gastric symptoms. So after RD, he says, selepas 3 minggu, what he means by muntah waktu pagi is the belching, because of the gas buildup. All that had subsided. His belching has subsided, his bloating is subsided. His smartwatch showed that he was sleeping much, much better. And he is still continuing to take the RD 1 to 2 bottles. Now, this is Chloe. Chloe is a 19-year-old student, eczema sejak kecil, yeah? And she's tried every topical and medication to control the eczema. It just keeps coming back. And then she came to see us and we gave her. So last time, I'm sorry, I don't have the before pictures. Why she is showing her elbow and the back of her knee is because the cracks there, the eczema was so deep, she cannot stretch her elbow fully because of the cracks. But now, all that has resolved because we also, along with RD, what we do, we optimize their vitamin D. So when you give vitamin D3, B12 injection, and you put them on RD, it has a synergistic effect. So one removes the toxin. Vitamin D improves the immune system. That's what your body is telling. Help me with the immune system. So all your patients with eczema, with skin allergies, with psoriasis, I'm telling you, I'm giving you the answer here. D3, B12, and RD. They will bring so many of their friends to come and see you back, right? Now, so you see the age group that we are seeing. We saw a 32-year-old, we saw a 19-year-old, now a 70-year-old lady. Always had a lot of bowel problems, gastric symptoms, cannot eat anything spicy. She eat a bit spicy, then have to telan PPI, Controlog lah, Nexium lah. You tell what brand, she will tell you which one will give her relief, which one doesn't give her relief. But after taking RD, all that bloating and the inflammation have come down, and she can even eat curry laksa. Okay. Next one. So you see, it's not something we reka saja. We have the message, the WhatsApp messages that we are sharing with you. Okay. Renal impairment, having already problem with the kidney. But now, after taking the RD, 3 weeks can lose 8 kilos. Naturally, yeah, we didn't even have to start her on any weight loss peptides. She feels so much better. The energy levels have come back. Another 50-year-old consultant on dialysis and having very bad skin itching and cannot, constipated means like he says, like, you know, it's so keras. So when he pass motion, sure akan luka, there can be bleeding also. And now after RD, even with dialysis, no more itching, no more constipation. And he still continues 1 to 2 bottles every week as maintenance. So you see, you can combine it with many other conventional remedies and therapies. It just helps support your whole detox system to work better. Yeah. So this is all the importance of why all these benefits you can see. Better sleep quality, better focus, less brain fog, more energy, better immune system, good digestion, and all your bloating symptoms reduces and improves your nutrient absorption. So that is why for R, first R remove, we use RD. Second R is when you do replacement with your micronutrients. Yeah. So this is my last slide. So we want everyone to stay healthy, not become healthy only. We want you all to maintain that optimal level of health. Then yes, after we do the detox, most of our patients, we do micronutrient replacement either through intravenous drip or intravascular injections on our own compounded. We formulate our own compounded food supplements as well. And we use a lot of peptides and hormones to optimize their health and bring back the balance to their health. Yeah. So thank you very much for your attention. Now comes the interesting part.
So far, you all okay with
Are you all
the...
okay? Any questions? Now is the time. Please type the questions in the chat, and Dr. Catherine, Dr. Genty will help us go through all the questions that all of you all have. Yeah?
Yeah, Dr. Getty, maybe you can help us. There is many questions in the chat room.
Yeah. Okay, sure. Maybe Dr. Grace has a question.
Okay.
Can she use this detox program for her patient with fatty liver and cysts in the liver?
Absolutely.
Okay.
It will help. What we see for patients with fatty liver is basically telling your body is overloaded with sugar content. There's too much of processed sugar, which now cannot be transported from the blood into the cell. So it gets returned back to the liver, and the liver is forced to convert this glucose into the cholesterol, causing the liver enzymes to rise, and you have cholesterol in the liver, which is called non-alcoholic fatty liver disease. So two root causes of NALFD, satu, too much of processed carbohydrates in their diet. Second is the non-conversion of the glucose into the cell, causing the accumulation of cholesterol in the liver. And reason number three is your hormones are not sufficient.
Okay.
So definitely can use RD to help clear out, detox out the fatty liver and the liver cysts.
Okay, the question still related with the liver, whether the patient still need the RD detox, even their liver enzyme, SGOT or SGPT looks normal in the lab, in the blood work. Do they still need the liver detox? This detox program?
If the liver enzymes SGPT, SGOT are normal, tetapi ultrasound still shows fatty liver, I would still continue the RD.
Okay, sure.
Thank you.
The
Next question.
Is there any preservative in the RD detox?
No, no preservatives. It's only natural ingredients.
We basically just use 3 ingredients: the amatas, the roselle, and the ginger.
No added sugars, no preservatives.
And the water, our water. Yes.
Okay. How about the dose? How about the dose for a pregnant and breastfeeding woman?
For breastfeeding and a pregnant lady, we always advise to go slow, maybe a quarter. Go with a quarter. All right. Then if let's say quarter doesn't work, then only we slowly increase probably the half to half. We don't go for like 1 bottle, especially like for a breastfeeding patient. No.
And we have used this especially in pregnant mothers in the 9th month of their pregnancy, right? Because the baby is big and the uterus is now moving down, they unfortunately get a lot of constipation. So we ask them to take quarter, that is 45 ml. They still can't go to toilet. We go up to half bottle, 90 ml, and they will have a really good bowel clearance and they feel so much more comfortable.
And do you know in ancient India, Pakistan, and Middle East, so where or even to now, up to now, certain very rural area, they have no access to conventional medicine or no access to the doctor. So you will see like every household basically they have this tree, right? That is to address the fever. They use a lot for the fever cases. And in ancient India time, they use these almatas to treat dengue and malaria. So I use this the most RD during the COVID time. My sales my shipment coming by container. Yes, to help on the COVID fever. Yes, right.
Okay, before we continue, can you stop your sharing screen so we can see other audience? Are you going to? Okay, perfect.
Yeah.
Like that. Thank you so much.
Okay, sure.
Okay, let's continue to other question. Okay, this is come from Dr. Andi. Is there any objective indicator that we can do for evaluation or monitor before and after we do the detox?
Yes, certainly. We use a lot of the gut microbiome stool test, one option. Then you can do your CDSA stool test. So that will tell you what pathogens you could be having, what overgrowth of certain microorganisms, certain strains of the bacteria is overgrown. You can use that, but to see a proper significant improvement, with that, you need to do at least 3 cycles of royal detox before repeating the test.
Okay, it's like in Indonesia now, like organic acid test, it can
Yes.
be. Okay, sure.
Can, yes,
Okay.
certainly.
Okay, is there any other question, teman-teman dokter? Mau ada? Okay, Dr. G, please
Yes.
silakan.
Doctor, so my patient has fatty liver and many cysts in the liver, but he lives from his childhood in an area full of industrial pabrik apa dok?
Yeah, it's
Pabrik
yeah, it's the
industrial area, many
yeah.
toxic.
Okay.
Yeah.
All right.
So
Okay.
how should I give the dosage for him? Because so many cysts in the liver.
Good. Thank you, Dr. G, for your question. How old is the patient? Yeah. What's the age of the patient?
60.
60. So you can follow the guidelines that we showed. You start with half bottle, continue half bottle for at least 2 to 3 months, no problem. Then you can repeat the ultrasound or you can repeat the liver enzymes and liver biomarkers to see how he is improving.
What are you giving now to this patient?
I gave him another liver detox, but too many supplements.
Okay.
So I'm interested to give this.
Is your product that you are giving for the liver detox help to move, help the patient to have the bowel movement?
Yes, he has diarrhea only for 2 days, but his cyst is getting smaller, but the insulin was from 30, but getting higher. Yeah, I think we have to do more detox. It's not you cannot do one time.
Yes.
You must make sure this patient has a good fat access. So you can give olive oil is very good to detox for the liver detox, or olive oil and also together with a good dose of the fish oil.
Oh, fish oil.
Omega
Yes,
3,
omega
very
3.
important.
Yes. Yeah.
Okay.
The
And-
liver and the gallbladder love the good fat.
Oh, and he has also cyst in the thyroid. So cyst in the liver and thyroid.
Then when the patient have the cyst on the thyroid, you have to check the oral health already.
Okay.
Amalgam.
Right.
Amalgam. Okay.
And then you need to give like certain binders that help to detox the heavy metals out also.
Yes.
That's
I
very-
see in him because of this fatty liver and cyst, it has an effect to the hormonal balance.
Yes, it will.
Testosterone and like that.
Definitely.
Yeah.
You might need to cut the fruits intake for time being, because
fruit intake.
Yes.
I don't want any
Fructose.
fructose to come in.
Oh, okay, I will tell them.
So diet is also very important. No fruit juices for this particular patient. Anybody with fatty liver, is because they are consuming a lot of fruit juice.
Oh, okay.
When
Yes.
you blend, even lemon, right? If you squeeze the lemon, it's become fructose already.
Oh, okay.
So kita just erase and infuse into the water.
Yes.
Okay, no fruit.
Cut it and slice it.
Okay, thank you.
Take it
Oh, okay,
easy.
cut it.
Yeah.
Okay, so this is
Infuse water.
Infuse in the
infused
water.
and we add sea salt into it. Not rock salt. Rock salt, you don't have all the spectrum of the minerals. Sea salt has more minerals.
Celtic salt, Himalayan salt.
Excellent,
Yes,
excellent.
Okay.
So like this is a 2-liter bottle. We put 1/4 teaspoon of salt and 1 or 2 lemon slices.
Okay.
So that really helps move the water and the minerals into the cells.
Milk thistle and dandelion tea is very good for this patient. So you can get some dandelion tea and milk thistle to help him.
Dandelion tea. Okay.
Yes, it's
I will
Yeah.
tell him.
Yes.
Thank you,
No
doctor.
issue.
Thank you, Dr. Grace.
Thank
Okay,
you.
another question. If you say that RD Detox has no preservatives, how can you make sure your RD is not easy to break? And then when is the expiration expire date? Like a 2-year, 1 year? If it's that long, is that
Okay, our expiry date from the day we manufacture, all right, is lasts for 18 months. 18
Sure.
months only. All right.
If
So
it's
how
that long, Is it
So long your product, the juice is pasteurized. Pasteurized means you remove out, totally there is no oxygen that inside the bottle that trapped. That there is no any microorganism can grow.
Show it closer. So you see the seal, the plastic seal is all the way to the top. And it is really, so when you koyak the plastic label and then you open, you'll hear a pop because air is going in. So it is like in a vacuum environment. That is why we have managed to keep it the longer expiry date without preservatives.
Yeah. But once you open, it shall last for like a week or how many?
Yeah. Maximum is a week.
Okay, so once you open it, let's say like for half bottle, so long you maintain the juice inside the bottle, even for 5 days, it won't get spoiled. But what happens if you poured it out? If you poured it out, you put into another container, it will get spoiled. You cannot, because I don't know what are the bacteria on the other container, but so long it's inside, it's safe because the bottle, before we added the liquid in, we pasteurize the bottle. We like sanitize, we pasteurize the bottle. And once the liquid filled it in, and we lock the whole things with the machine, with the lock system, then we pasteurize again. Before there's another another wrapping method come in.
Okay.
Yes, and the almatas that we are actually the product come from Thailand. It's come from my factory. So what happened is that we go to round all the Thailand, all the rural area to collect all the flowers, the pot, the seed, the branches, everything. If you look at the almatas tree, it's not only the flower that come with the benefit, it's the pot, the branch, the leaf itself.
Yes.
Every part of it come with a different benefit, different function. Right.
Okay. Another question, if you pasteurize that, is that meaning that nutrition in that RD bottle will be reduced or?
No, okay, because the almatas, the benefit, we want the benefit. It's not about the nutrition things to come in. It's not food. We don't treat this as a food.
Okay.
All right. Yes. So we want the function of it. And previously, we don't put any ginger. So we find that after take it, we still feel like body like very cold. Then only we realize actually with this is have to go with the ginger. So that's how the ginger that come in later on.
So
That
we
was
are,
the part.
so
Yes.
we are not looking for nutrition value in this. It is just to detox.
Hmm.
Yes.
Okay. Understand that. Okay. Dr. Eunice,
The heavy metal. Okay.
yes.
So far, I'm sorry, I don't have the data about the removal of the heavy metal. But I wish that one day I can share with you about my own testimonial. So you all know that I do, I'm not sure you're all aware that I do like S-Drive, the hair test. Through the hair test, that's how also we use the hair test for our patient, right? So before the vaccine come in, because I do detox a lot. So before I took the COVID vaccine, when every time I do my hair test, my toxic metal level is actually zero. It's zero. I can show you my whole the test next time. So it's all zero. No, you won't detect any toxic metal at all. But after I took like the second vaccine, it shows like toxic metal, it shows chemical, and it shows radiation. And that's when I was diagnosed with a hyperthyroid. After the second, the Graves' disease, after the second dose of the vaccine. There is really bad, I tell you. So what happened that I seldom pick my own product, because I know it's very good, but I just, okay, no, not today. I always give excuses for myself at the time. All right. Then come to the point that like I know the drug is bad for me. I'm not going to take any of this, all these conventional drug. So then my master from Thailand called. I think it's time for you to do the detox again because I was away from my center, during the COVID time, during the lockdown. So okay, then I only that time I started, and also this guru say, come on, like it's time for you to detox lah. Okay, so I take like every alternate day. I start with every alternate day. Then I probably about 8 or 9 months later, when I repeat my test, only I start to see my toxin metal come down, my chemical come down. And now the last one or last year I did back to zero, my toxin metal. But
Great.
if you talk about the data, you can look at Almatas come with a lot of good benefit data. But unfortunately, there's no data about the heavy metal, so I cannot claim. But that is my personal experience that I can share with you, my own personal testimonial. Yes.
Okay,
Mm.
thank you. Is there any other question? Teman-teman mau
And
address?
someone I saw that
I would like to ask the question. Have you experienced or testimonial from your patient to reducing the gamma GT liver and the liver function like is GGT, GLT, and also gamma GT? After your detox finish, it will decrease your liver functions?
Yes, it will come back to normal levels. It won't drop too low because we also have to combine it with diet modification, lifestyle modification. That is the first one that really keeps it stable. It doesn't cause a rebound. So first, we will see whether the patient is on anti-cholesterol medicine statins, because statins will raise your liver enzymes, including gamma-glutaryl transferase or GGT. So when you take off the statins, you correct their diet by giving them more omega-3 and olive oil and good fats, and you combine with RD, the liver enzymes will come back to normal, but they don't drop to below normal levels. And it stays that way as long as their diet is maintained.
Have you any
So-
experience after the royal detox, the liver functions raising up, like GGT raising up?
No,
Okay, thank you.
welcome.
my dad is a cirrhosis patient. He had a cirrhosis issue for like since when 10 over years back. But the time was like quite bad. So to cut the story short, he is now like so healthy that I wish I can share with his photo with you one day. He's so fit, so healthy, and he's taking the RD like 1 to 2 bottles in a week now as a maintenance. Yes, he really looks good. He's like 70 years old and coming this Saturday. Yeah.
Wow.
Yes.
Okay, is there any other?
And over here, we actually in Malaysia, right? We only distribute to the doctors in Malaysia to use it. You weren't able to get this in any of the retail shop, pharmacy. No, all the medical practitioners who are using it for their patient, and we work a lot with the functional on-call. So for any of the cancer cases, before they start any treatment, they will prime this with the patient and patient with the autoimmune disorder. So like today, there is one hospital, like a private hospital. There are few surgeon specialists who came and talked to us. They wanted us to manage their autoimmune patient, because in conventional treatment, basically, not many solution, not many treatment that able to help the autoimmune patient. So today, just few of the surgeons that just came to us, and we would share with them. No, still we have to use this as our part of the protocol, and at least they are happy. So now they're happy to know that at least we have the solution for their patient. Yes.
Okay. Is there any certain food that we have to avoid during consume RD drink?
Very good question, Dr. Yanti. Thank you for the reminder. So normally during the first cycle of the detox, we will get the patient try to avoid gluten and sugar. Because what happened when it's trying to remove the toxin out from the intestine, the clogs too, then basically, after the intestine wall get clean, it will seal very fast if the patient have the leaky gut. So what happened if during that time it start to clean up, and if gluten go in, it can stick back to the wall. All right. So, and best to ask them to drink like mineral water. If let's say elderly, sometimes I ask them to drink like some mineral water to help to boost back, or might sea salt water like what we are doing here. Yes. Yeah.
Another question, do you have before and after lab tests for RD detox from your patients?
Yes, yes, we
Yeah,
do.
we
Sorry,
do.
we didn't include it in. If you can drop us your email, we can share the before and after, or even the WhatsApp number, or we will send to Dr. Genty, and then Dr. Genty, you can forward it to Dr. G to show the before and after, certainly.
Yeah, we do ship to Singapore as well. Yes, you can
Yeah.
contact
one of
us.
the-
Yeah, you can contact us for that.
So, take down that number.
So, okay, what Andre is it? Andre asked about the grounding. So grounding, yes, okay, what we actually, all the EMF, all like pollution, air pollution, that is positive ion. So what is negative ion? Okay, when you go to like hutan, you know, the mountain, the waterfall, then you feel like so fresh. That is actually the negative ion that we need. And grounding is where it helps to pull the positive ion from the end, from the body down to the earth. Then why after grounding you feel so light? Because that is where there's the negative ion come in.
Yeah.
All right. Yes.
Okay.
Well, I saw like Bijit Delima and the okay. So Bijit Delima, if I'm not mistaken, is the pomegranate juice. So pomegranate juice is a wonderful juice, especially for the gut. And I will always I will ask my patient to take a pomegranate juice, especially for those who found out have a H. pylori. So you see, when a patient especially nowadays, right, where after the vaccine, we find that their gut is so easily inflamed. And this is also, we see a lot of the rise of the colon cancer. That is because if you all would know that basically the first dose of the vaccine is kill up the whole microbiome of the colon. So you will see the rise of the colon cancer coming in. Then suddenly, like a lot of people that have like H. pylori, the candida, the C4, the SIBO, all right. So when my patient came in, they told me that they have a H. pylori history before, or maybe the first cycle of the antibiotic doesn't kill off the H. pylori virus, bacteria. Then we will ask them that when you start the next round of the antibiotic, you can please combine with the pomegranate juice. It's very powerful to kill H. pylori virus. Yes. Lactose. Okay, there's a first question from Yurelia, doctor, right? Bagaimana? Okay, detox khusus dengan lactose. You means laxative or what? The first question.
Maybe meaning laxative, probably. Let me see that question.
Because we don't encourage the laxative.
We don't encourage using laxatives, but it's synthetic and it pulls out a lot of your natural minerals in the body. That's what causes all the cramps and all that. So that's why we not prefer to use laxatives, even like Senocort and Dalcolex and all that. We prefer to, and that it doesn't really clear out the whole intestine. It only clears out the physical or mechanical stool, but not the one that is stuck along the intestines.
Okay. I don't understand this question.
Okay, so and also the RD contains the prebiotic. It contains a very good prebiotic. So of course the probiotic, this is what we need also, you know, the daily terms. So you can also combine that with the probiotic, whatever that you have. But itself is contained a very good prebiotic. Because the Almata's prebiotic means it's able to like break down the food. It's work like an enzyme.
Question: if the cancer patient they are taking the ivermectin during the protocol, They
Mhm.
can still take the RD detox together with ivermectin?
Yes, sure, certainly can, Dr. Ganti.
Sure.
So the
Fungus
RD first,
removal.
consume RD first, half an hour to 1 hour later, then take the ivermectin.
Okay,
Sure
perfect.
Like even like fluconazole, a patient when we found they have the fungus, you know, it's the
It can,
very
yeah.
combination.
It works synergistically.
Yeah, like if they have like zeolite or whatever, you know, for
Yeah.
the heavy metal removal is a
And the
very
fulvic acid, it can be combined with that.
exactly
Correct,
yes.
Sure.
So all these
Okay.
probiotics, all that can be combined. Just jarakkan the masa between taking the RD and all the others.
Okay. Any other question? Maybe dokter yang di sini ada yang mau bertanya? Dr. Yurika mungkin?
So in future, maybe some will ask like where to get the stock, anything. So we are now actually working with Dr. Ganti. We will try to and Dr. Catherine to ship in the product to Indonesia. In the future, doctor, those who are interested can probably talk to Dr. Ganti and Dr. Catherine.
Sure.
Yes. Yeah.
Yeah.
Okay, then I'm living in Singapore. How about if I buy, how to ship to Singapore?
We do have many of the doctors who from Singapore are actually taking it from us. Maybe you can
We will
get my contact and see how it will
We
work.
will try and detail of it.
Mm, mm.
Okay, thank you.
Number, then we
So
will
this
contact
product
you.
is from this RD is from where?
It's from Thailand.
Oh, okay, just now. Okay,
It's from
sorry. Okay.
Thailand. Yes, because of the raw material, and it's from our own place, our own factory who made it. It's not the third party things.
So gluten and this what sugar when we
Yes, it's
detox
possible.
use
I think the
Yeah.
gluten.
gluten and sugar. Okay, okay.
Right. That's the best now to reduce the sugar, but because not everyone able to reduce the sugar intake, you know, sometimes they drink the tea, coffee, they need to add sugar, but at least with the gluten,
I mean, during the detox
Ah.
time, right?
yeah, yes.
Thank you.